Hi guys, let's talk about the basics of suturing, right? Suturing is a very basic but a very important art that you need to master. So before we start about suturing, we'll talk about incision and then we'll talk about various types of suturing. And in order to put an incision, you need this guy. What is this guy? This is your BP handle, which is the ball parker handle. Now, whenever you have a BP handle, you see there's a groove that is present here. Now, this groove that is present is where you're going to load your blade. I'm going to show you how do you load a surgical blade. Now, this is your surgical blade that you have. Now, when you look at the surgical blade, you will find the number of the surgical blade on top of it. Here, you can see it is 11 number blade. So, what I'll do is I am just going to pop open the blade. Now, this is the base of the blade that you have. You take an artery forceps or a mosquito and then just hold it across it. So this is how you're going to hold, this is how you're going to latch it across, right? Now you should make sure that you should not touch with your hand because one, it is unsterile, second, it is unsafe also. You take the BP handle and you see which angulation that it is present. Now you can see it is angulated at this end. You just hold it across here and gently leave it and slide it. This is how you position your knife and the knife is now ready, right? You can see the scalpel is loaded and we are ready to make our incision, right? Now, let's make an incision and we'll decide that what are the different types of suturing that we can do, right? So I'm going to take, see, another way is how you actually hold this knife. That's a very important concept. Now, there are different ways of holding the knife. You can't hold the knife like this because you're not going to poke anybody. We are not killing, we're saving patient's life. So how do you hold it? The two most strong equipment that you can have in your hand, one is the pen, another one is the scalpel, and you hold both of them in the same way, right? So that the way you hold your pen is the way you hold your scalpel, and this is the right grip. There are another grip that you have where you can have the fingertip at the end and to have the precision. Now, if I'm making a longer incision, I would prefer this incision or this grip where I can just cut open. If I'm making a very precise incision, like you're making for a face or a nose or a tip, you'll use a pen grip. Now, because we have a longer incision, I will use this grip. What is this grip? Hold it, put your index finger, this is your guiding one, right? Now, wherever you want to put the incision, I'm going to put the incision here. This is where we're going to put the incision and we have the incision, right? Now, once you have incised it, our job with the scalpel is done. Ask your assistant or the nursing staff to give the kidney tray. You put the knife into the kidney tray and let it go safely, right? Now, the kidney tray is taken, the scalpel, it is off the table, and now we'll start suturing, right? So I've cut open the incision. After the incision, we'll start the suturing process. So we have created a wound, as you can see. See, there's a beautiful wound that you have. Just to show you better, I'm just going to open up the wound, and banana peel has this beautiful architecture which gives you the exact feel. You can see the entire banana is now clearly opened up. Now this is the entire incision that you have, right? Now, once you see there are two ends like a skin end, this is lifted on, this is another one that you can lift it across here. Yes. So this is the another one, right? So our job is to suture these two ends. So let's talk about various types of suturing. Right. So first I'll be demonstrating a simple interrupted sutures and then we will take up from there. Now, how do you take a simple interrupted suture? The first thing is to load your needle. Now, when you look at the needle, this is the entire circumference or the circle of the needle. Usually we load at the 1/3 of its location. So if you divide the needle into 3 equal halves, it is between the 1/3 and this is the 2/3 of the needle that you have taken, and this is the 1/3. So needle or the needle holder is going to be locked between the 2/3, which is the anterior part, and the posterior 1/3 of the needle, right? This is the hub and this is the entire needle that you have between the 2/3 and 1/3 of the needle, and this is where you are going to load it. Now this is the entire suture thread that we have. Usually you stretch it so that you get rid of the suture memory. Now the suture memory is lost, right? It is becoming straighter. Now the more you pull it across it, the suture memory will become easier for us to work across, right? Now I have the suture material in my hand and we have to start suturing, right? Now we'll take the first bite, which is going to be an important one. So every single time you take a bite, you lift the edge of the skin, lift it, you pierce the skin and come out, right? You hold it with the forceps, you reload it in the same fashion, pull it across and then you keep it on one hand. Same thing on the other hand, lift the skin, pull it up and come out. Now, once you have come out, leave the instrument which is in your hand, hold the needle. Always the tip of the needle should be pointing outwards because you don't want to prick yourself or your assistant. Take these 3 fingers and roll it gently. Now, as you roll it, you'll see the other end of the thread is there. Now, if you roll it too fast, it will slide away. So, always hold it with the needle holder, bring it to its desired location from where you want to keep it. Now, put your needle holder between these 2 ends of the thread, make 2 gentle circles. Put the needle holder between these 2 threads and now loop it gently. Once you have looped it, hold it at one end, and now you can see there's a 2 knots on bottom, and you gently slide it. Now this is the first part. Take the needle in between. Now you come in a reverse manner so that you square it, hold the thread, hold the tip end of the thread that you have just put across here, and you reverse it. Now this is what we call it as a surgeon's knot, and you tie the knot. Now because of monofilament, I would like to throw another extra ones, right, so that I secure it. Now once you have taken the knot, this is what we call it as a simple interrupted one. Now once you've done this, take the scalpel or the suture cutting that you have and excise this thread, right? So this is how you do your simple interrupted. Now I'm going to do a little bit faster so that you understand better, right? Let's do the simple interrupted again. Load the needle, hold your forceps, lift the skin, pierce from one end, take the skin on the other end, pierce it from the other end, gently push it, hold it, take the needle in your hand, hold the other end of the suture in your instrument, circle, 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 circle. You're here. Put it in between, take 2 loops, put across it, tie it across, right? This is the first thing that you have done. Come back again, second knot, take one more just to secure it, and this is how you do your simple interrupted, and then cut your thread, right? So this is how you perform your simple interrupted sutures.